Thank you for attending this breakout session. This session is filled with powerful information to help improve your health and empower you. Radio Free 102.3 KJLH. We are you.
Family, it's Ade Lamar, and we are doing our KJLH Women's Health Expo virtually. Hey, everybody!
Hi.
I'm so excited that we're able to do this year in these unprecedented times. Everything has gone virtual, and we could not do our 20th year as we are celebrating. Ladies, it's all about you today. And today we were able to get our Covered California crew to come in and share their wealth of information about what they have going on and how we could actually use their resources and sources to help us in our everyday lives. COVID-19 has come in and seems like it has just turned our world upside down. But the great thing is that we have people that are really looking out for us and really helping us during this time. And that's when these young folks come on in. Hey, everybody. So I want you to meet everybody, family. Ladies, if you're watching right now, I want you to meet everybody. We're going to start with you, my beautiful one.
Hi, I'm Claudia Kitty Bustamante, and I'm the Southern California Regional Field Manager. And I work with a wonderful team of people who provide support to all of our enrollment partners in the Southern California region, as well as grassroots support.
I love it. I love it. And the next lady.
Hi, I'm Margot Thomas, and I'm the head of Crenshaw Health Partners, Inc. We are a very small nonprofit organization who works with Covered California as a part of their Navigator program. So we will talk about that a little bit later on.
Small but mighty. And the gentleman who is stuck with these girls today. I love it. I love it. We love
Tough
that.
place to be. My name's Robert Blevin. I'm a Covered California certified insurance agent. I work out of the Inland Empire. I've been working with Covered California since the beginning in 2014 and enjoy getting people enrolled and covered.
Well, I tell you what, the last time we were all together, it was just the beginning. I don't think anyone was screaming COVID as loudly as they are now. We were just talking about it. I remember one of your executives were in town and he was traveling back up north. I'm like, here, take a mask, wear a mask. He's like, no, I don't need that. And we eventually convinced him to take that mask. I think that was back in like February, maybe January, February.
It was the end of January.
It was the end of January and he took the mask, thank God. Little did we know, though, that COVID-19 was actually in the States in November. A lot of the research is saying that it was here as early as in October, November. So it's great that people were taking precautions, wearing the mask. Of course, I was probably like only one of the whole airport that had them on, me and one other lady at the time when I was traveling in February. And but it's so important that we do what we can, and great folks like you come together to share with us why it's so important that we need health coverage, not just because there are certain penalties that are involved now that says that everyone in the state of California have to have insurance. But during these times when COVID-19 is out there, you really want to feel like you have somebody on your side that can help you navigate if you get sick and what to do. And I'd like to start with you, Ms. Claudia. Is Covered California, I get this question all the time, and the ladies that are listening, is it Obamacare? What is it exactly?
It is Obamacare, but the actual name is Covered California, and it is the name of the state's exchange. The exchange is where people can come and find health plans that they can choose from and make informed choices on the type of healthcare that they can get. But Covered California is the name of the exchange, and a lot of people do refer to it as Obamacare, which is very positive.
So, but Claudia, with everything that's happening with COVID-19, how has that impacted Covered California with enrolling? You guys have an enrollment period that's happening right now. How is that affecting with COVID-19?
Well, I must say that we have had a fairly large increase in people enrolling. We are currently in special enrollment. We are currently in a special enrollment period, which ends until July 31st. But Covered California is trying to evaluate the possibility of extending the COVID-19 special enrollment until beyond August if possible. But it's under evaluation.
Well, I'm sure a lot of people are hoping that happens because with the penalties that we can now face and everything, let's talk about a little bit about that. What can happen to you if you don't have health insurance?
Mr. Blevins, you can also jump in on this. I do know that it is the state law now, and that was initiated in starting 2020, where there is a state penalty, and the penalties are $700 per individual if you do not get insurance, and
$2,295 per family, and $695 per adult, which is anyone over 18 on your tax filing.
That hurts your pocket. You could easily get insurance with that kind of money.
Exactly,
right?
You can. And that's why we're encouraging people to enroll, because the cost of the penalty can easily go toward the cost of purchasing healthcare.
Now, what are some of the benefits of having covered California health plans? I know the preventative care, or just having health insurance coverage in general. What are some of the benefits of that?
Well, some of the benefits are that you can stay healthy instead of waiting till a disease or illness gets to a point where it's more expensive to treat it. The whole purpose of having the Affordable Care Act was that people would take better care of themselves, get checkups on a regular basis, get that little cough or that little whatever checked out before it becomes a full-blown problem. So you can't go to another place during an emergency. So having health insurance improves your odds of going to a hospital in an accident or other situation where you get treated and get taken care of properly and timely.
Well, let me tell you.
Can I jump in?
Sure.
Also, for mothers to be maternity care and newborn, they can get treated without having to pay. And the same with the preventative care that was mentioned before. They don't have to pay. There's no copay. That's the advantage of Covered California or Obamacare. And those are just a few of the benefits of signing up with Covered California.
One of the other benefits are pre-existing conditions. If you have a pre-existing condition, you can still apply and qualify for a Covered California health plan. And this didn't exist prior. So it's a huge benefit for many people across the state.
Well, when you say pre-existing conditions and we talk about COVID-19 and the research that shows that African Americans are being really plagued with COVID-19 because we have these pre-existing conditions, you know, it is so good to know that we can get some coverage, you know, because we're concerned with COVID-19 that's out there. We've been told that these pre-existing conditions make us so much more susceptible. And now there's a possibility that, you know, we can get this coverage without worrying about those. That's big.
Definitely. And, you know, in the African American community, as we all know, we suffer from significant health disparities, such as high blood pressure, obesity, diabetes, and the fact that we can easily just go and apply and get a health plan, and also have enrollers who can help us make informed decisions around what types of health plans are best for us, and especially the health networks. I think it's extremely beneficial for people in the African American community to consider and look at what their options are.
Now, what's the difference between Covered California, Medicare, and Medi-Cal?
I can take that one. So Medicare is for 65 and above.
Okay.
Medi-Cal and Covered California is for everybody from 0 to 64. And depending on your age and income, you may qualify for a Medi-Cal plan, or you'll qualify for a Covered California plan. But as long as you are a eligible recipient, meaning you have employment authorization or green card, or you're a U.S. citizen, everybody qualifies for a plan under that umbrella. It's just whether or not they'll qualify for Medi-Cal, Covered California, or Medicare for 65 and above.
With everybody so concerned about that bottom line, that dollar right now, you know, everyone's looking at how they can save because we don't know what's happening or what's coming. But you guys are actually helping even more so financially folks cover their health coverage. That's big.
One of the things I think people forget is that the Covered California's larger name is the Affordable Care Act. And a lot of times people forget that without the Affordable Care Act, these benefits could cost them hundreds of dollars a month, well above the maximum 10% of your income that the Affordable Care Act targets. As a self-employed person, if I wanted to get insurance outside of Covered California, it could cost me $1,000 a month. And that's $1,000 whether you go to the doctor or not.
I know.
So it's the Affordable Care Act certainly makes healthcare affordable for most Americans.
But Robert, as an agent, when you're getting folks registered and getting them insurance, what are the things that you see that we as the consumer need to consider that we are lacking when we come in? How can we be better prepared when we sit in front of you?
One, I think, is just understanding the cost of healthcare. Mm-hmm. People forget that they've had benefits through their employer maybe in the past, and then when they come in to get coverage through Covered California, they may still think it's expensive. So I often show them that without the federal or state assistance that they receive, that plan for a family of four, maybe they're paying $250. Without that assistance from the state or the federal government, it might cost them $800 or $1,000 a month. So really, to me, the importance is the Affordable Care Act, understanding that you're getting federal assistance to make this plan affordable. And at the end of the day, the goal is to keep people healthy. Go to the doctor. One of the things I say right after I sign someone up is go get a checkup. The checkup is free. Get a baseline, understand where you're at today so that you can get healthy or stay healthy versus letting a problem evolve and become a bigger problem.
I think it's great that you guys are offering more assistance financially, because people, you know, they lost their job or they weren't working to begin with. They think they can't get insurance or they can't get covered. What do you tell them as an agent? If I don't have a job, can I get insured? And if I've lost my job during the pandemic, what can I do for coverage?
If you're a single person and your income is below about $17,300 a year, you're going to qualify for free Medi-Cal. So depending on those frontline workers, the service workers and the people that are on minimum wage, in many cases when they're collecting unemployment, they're going to qualify for free Medi-Cal. So get that free Medi-Cal, get enrolled, and when you go back to work and you get employer benefits or your income increases, we'll see what you requalify for. And maybe you're on a Covered California plan, but with federal and state assistance.
But how do you calculate your annual income though? Like if you were a contract, you do contract work, you're Uber driver. How do you calculate your income to know what you can afford and if you even qualify for certain things?
The best way for those contract employees is to use their tax return. Mm-hmm. Because for self-employed people, it's after expenses. So you have your gross income and then you have your expenses, and it's the net that is the income that qualifies you for a Covered California plan. So if you're in your first year, it's kind of tough. I can tell you, just doing taxes as well, it's about 30% of your income is tied to expenses as well. So we take 30% off your gross number, and that's kind of the estimate that we use to establish your annual payroll. And if you're an hourly worker, it's kind of simple. You just the hours times the number of hours a week times 52 weeks a year.
Okay, so I was telling everyone, I put it on social media that I was going to have you all to come in and talk. And I have different folks kind of just shoot me little messages on my Instagram. Is it okay if I read one of the questions they have for me? This one says, if my employer covers someone's health insurance for free, but they have to pay for their spouse and children, can that person enroll them into a Covered California plan? That's a good question.
That is a good question. And it depends. It depends on whether or not the cost of employer benefits is greater than about 9.78% of their income. Mm-hmm. Why that 9.78? Somebody up in the big sky figured that number out. But basically, I round it to 10%. So if you're making $50,000 a year and your benefits through your employer are going to cost you more than $5,000 a year, then it's not affordable, and you can use Covered California and their federal assistance. But if it's within that 10%, then you need to go with the employer benefits.
Oh, okay. That's good stuff. That's really good stuff. I hope I'm gonna text them or DM them back to tell them they need to, your answer is there. You gotta watch it and get it. Okay, so you're in what, in Inland Empire out that way?
I am. I have an office there and one down in Temecula.
Okay, so with African Americans, are they enrolling in the coverage there at a good rate in Inland Empire?
I believe so. You know, and the question is always, what's a good rate? 100% is a good rate. And we're not at 100%. And that's really where we all want to be. So I don't tend to get resistance from the African American community. Many of them are employed, and so they're getting benefits through their employer, which is a great thing. But for those service workers that aren't, many of them are qualifying for Medi-Cal. And many of them now are out of work, and so they're still qualifying for Medi-Cal or other benefits. So I think the biggest thing we have to do in the African American community is do better at getting the word out, letting them know that there's federal assistance and state assistance there. And the state assistance limits have really increased. So there's a lot of help there to make it affordable.
I love that. I love that. Margot, I'm coming to you, girl. Go ahead, Claudia. Go ahead.
To add to what Mr. Blevin is saying, Covered California is making a concerted push to make sure that we partner with community organizations across the state and with agents such as Mr. Blevin's to get the word out, to make sure that people in the African American community are informed and have access to be able to apply for healthcare.
Well, I tell you what, Covered California, I've been working with you guys for quite some time, and I must say, you are all over our radio waves. It is not because they are not pushing the message. And I love the fact that I was talking to you earlier about the different vignettes that you allow us to do in the morning to remind people of the deadlines. Those things are very, very important, because when you get busy, even though we're in a pandemic, everyone seems to think that, oh, you're just twiddling your thumbs and there's nothing going on. You still have things that are coming at you during the pandemic. And when you have that radio on and you're hearing that message, oh, you got that deadline, it does subconsciously register with you that, hey, that's right, I need to get this done. So big thank you to Covered California for pushing that message as hard as you do.
Yeah, you know, one of the ways we've been working recently is also working in phone banks and trying to figure out ways in the virtual atmosphere to, you know, to get the word out, you know, via organizations like KJLH and community nonprofits, and just even Facebook and Twitter. We are out there and we're trying as much as possible to find all the types of avenues we can to get the word out.
I love it. I love it. I love it. Lady Margot, you ready?
Yes.
Now, you brought this up, the Navigator program. Tell me about it and how you guys were able to come together and make that work for our community.
Okay, well, the Navigator program is a federally mandated and funded, it's a federally mandated program, and is funded by Covered California. And we work with, or the Navigator program works with faith-based and community-based organizations such as Crenshaw Health Partners, which is my organization. And they work with us because we have the experience of reaching the diverse populations that do need this insurance and coverage and information. And because our primary focus, Crenshaw Health Partners' primary focus is on improving health literacy and promoting health, we were a good fit to be a part of that program. The Navigator program provides free assistance to the average consumer. And we focus on reaching out to primarily the underserved communities, such as your African American communities, Latina communities, and the LGBTQ communities, as well as others. So we pretty much, the Navigator program rounds out the outreach for Covered California.
I love it. Now, you guys are located in the mall. But with COVID-19, everything's closed down. How are you doing? How are you faring over there? Are you able to still reach folks? I mean, what's happening?
Well, you know what, Day, now that is a serious challenge.
Yeah.
We are located in the Baldwin Hills Crenshaw Mall,
Yeah.
next to the eyelash place on the second floor. But the mall is closed.
Yeah.
And even though we are essential workers because of the work that we do, we can't do it at the office. So we have to get creative or try to get creative. Right now, we're working by phone. So if people were looking to get insurance, or they know that we exist, or they may go online to Covered California. Kitty, help me with the URL to find help.
Yeah, find help near you. Exactly.
Yes, yes. And so if they find us and they call us, they can leave a message if we don't answer, and we will definitely get back to them within 24 hours. But in the meantime, that's just one way. We're trying everything that we can. And it's just not.
You got to get creative.
We have to get creative. So, we are working in collaboration with other nonprofits, other faith-based and community-based organizations, and health professionals. And we are looking to do quite a few more, or quite a few virtual sessions. And when all of this, when the shutdown ends, because hopefully it will not shut down completely, but when we're able to open the doors again, people can feel safe about coming to our office because we have already taken the precautions. Right. My certified enrollment counselors, and we refer to them as the CECs, come in with a face shield and a face mask. We wipe down everything that has been touched by the client, and we prepare for the next client, and we do safe distancing. So, for many people, it's really comforting to be able to come in or to talk to someone who can help them and understand the challenges that they may be encountering in trying to understand this whole insurance game, so to speak. Mm-hmm. And that's a part of what the Navigator program provides.
You guys are always out. I mean, we do events, you guys are there, and having to be creative with the things that you're doing now. I know I'm trying to think what kind of events will be coming up that you could be a part of, and things like, are you guys thinking that far in advance as to what's going to happen? Because look, just as we start opening, we got to close everything down.
Yeah. Well, I need to reiterate, we are still open. That is for sure. We are still open. But in terms of the events, we don't have anything right now, but we are planning on doing collaborations with other organizations. As a matter of fact, I have one tomorrow with USC and the Los Angeles South Chamber of Commerce, virtual, of course. Mm-hmm. So we're doing whatever we can, and we're working on social media. Now, Covered California has a great toolkit for social media. And I will say, as a very small, nonprofit, community-based organization, it is a challenge for us, but we have to, and we are beginning to get more involved in the whole social media game. It's a challenge, and it's a work in progress.
But you know what? I would think if they provide the tools for you, it could make you look big, big, big. You just got to get in there at it, because I love that. I love that they're providing the tools for you to do it. I mean,
exactly.
Especially Covered California being the organization, Claudia, as big as you are. I love to hear that you have resources available for those that you're working with, that you're under their umbrella too. It's like they're taking care of you guys too, to make sure that you keep doing what you're doing.
And we really try hard to support our community enrollers and our agents, and provide them with as many tools as possible. The social media guide that Margot's talking about is available to any of our enrollers, so that they can use it to be able to draw people to them. The other way people can also get information on being able to enroll is the Covered California webpage, where they have access to enrollers as well as agents. So we have a Find Help Near You, like we talked about earlier, which enables you not only to gain access to organizations such as Margot's, but also enrollers such as Mr. Blevin's.
I love that. I love that. What are you hearing, Margot, when you're coming in contact with our community? What are you hearing as far as what are people saying about the insurance? Are they saying they can't afford it, or are they just don't have enough information? You guys are giving it to them. What can we do to encourage more African Americans to really know that they have this insurance that's available, this coverage that's available to them?
Well, what I will say this is COVID-19 has just altered everybody's life. We know that, okay? There are so many people who have lost their jobs, who've had reduced hours, who are collecting unemployment. And although efforts are being made by the city and the state and organizations to provide food and other basic needs, the fact is people are stressed. And that's really bottom line. They don't even want to think about insurance. So what can we do? What I can say is you don't want to think about insurance, but you really need to, because the smallest injury, accidents happen, injuries happen, anything can happen at any time. And people really do need to be aware of that, because if that happens without insurance, you're going to have to pay thousands of dollars for the smallest injury. And people can't afford that. So we talked to them about getting coverage, about the extension of the premium subsidy. Now for this 2020 year of coverage, Covered California has extended their premium subsidy, has expanded, their premium subsidy availability, so that it goes to a single person who's making $74,900 and some odd dollars that may qualify to get a subsidy. Whereas before it did not go that high. So it's been extended so that more people can get the help and possibly more money. A lot of people who did not know that before should actually contact us. And I say us, Crenshaw Health Partners. I'm just putting in a plug. If they were to call us at 310-736-8722, we can help them to determine if they qualify and how much they will get. It doesn't hurt for them to do that. So that's one thing. The fact that people really need to understand, really do need to understand that you need to have some kind of coverage.
Yeah.
In spite of everything else.
I'm telling you, I was sharing with you guys before we got started. Last week, ended up in ER. Had never been in ER ever in my life. I've gone with other people like, oh, let's take you to ER. But I had to go to ER. And during COVID, when you got to go in by yourself, and I'm having these issues of stress, and I can't imagine having to sit in there and they say, well, do you have coverage? Or you know what I mean? Or to sit there and stress about that too. You never know when you're going to need insurance. You're just always glad that it's there when you need it.
Yeah. Well, right. one of the essential covers of the Affordable Care Act is mental health coverage. So right. Everyone who has a Covered California plan has mental health coverage. And so you don't have to wait till you're getting chest pains and go in and talk to somebody before you get to that point. And it's covered.
I was like, whoa, wait a minute, maybe I should go. Because there are so many things that are happening with us with COVID. I speak very candidly that I care for my mom. I'm a caregiver, and I've cared for her for 12 years. I moved her here with me 12 years ago. And I was not prepared for what the pandemic, when everything happened and they shut us all down, I was okay with that. I was like, oh, cool, I can work from home. We don't have to go into the office. That was cool with me, but I did not take into consideration what that would do to a senior, breaking her routine, not having to be around other people, just what it would do to her. And it has totally changed her in the last month and a half. I mean, totally. And it has stressed me out so badly because, I see the changes and there's really nothing that I can do right now. And so, yeah, I then ended up in ER. So you never know what's going to happen with these times, these things that we're going through. Insurance is something that you don't think about until you need to think about it, right?
That's right.
Robert, give us how we can get in touch with you, where you are.
Yeah, the best way to reach me is on my public cell phone number, 909-462-2864. Of course, if you click on the Find Local Help on the Cover California website and you put in my zip code, then you'll find me there too. So
Any
either one of
last
those is a
thoughts you
great
want
way.
to share with everybody to remind them to get coverage? Anything you can, some wisdom you want to share with us as we get ready to get out of here?
Well, the one thing I'll say about insurance is that you're always going to need it. A lot of people say, well, I can go to the free clinic or here, but in an emergency, they're going to take you to the hospital. They're going to take you to the hospital and they're going to run up a bill.
Yep.
And a medical bill is one of those things you can't file bankruptcy and get out from under. So it's going to be there.
Yeah.
And when you put the few dollars that you might have had to spend for a month, I can tell you a heart attack is about a $60,000 bill if you don't have complications. So get that insurance. The $100 a month is a lot cheaper than having that big bill sit in front of you and then wonder how you're going to pay it off when now maybe you're sick and can't work the way you used to.
That's 60,000 to give you another heart attack.
Absolutely.
Margot, any last thoughts on how we can reach you?
Yes. Well, again, you can reach us at 310-736-8722. Our zip code is 90008. And what I'd like to add, consider Cover California to be like the protective mask that reduces or prevents those high costs that people will have to pay.
Yes, I love that. I love that. Claudie Kitty Bustamante. I've been wanting to say your whole name. I love your name. Cover California. Thank you for everything you do in our community. You and Cover California, you guys come through for us each and every time. What would you like to leave with us?
Well, Adai, I think the important thing is for people to know that Covered California is committed to health equity, and we want to make sure that we step up our efforts to promoting and encouraging people to gain access to healthcare as much as they can. And by working with partners such as Margot with Crenshaw Health Partners and Mr. Blevins in the Inland Empire, we're trying the best we can to make the access to healthcare as available as possible. I also want to plug Covered California because there are definitely many ways in which people can apply. By going to the coveredca.com website, they can find help on demand. They can find storefronts near them. And also, because we are now in a virtual world, there are ways in which our enrollment partners are also finding ways to help people virtually.
I love that. I love that. Guys, thank you so much for joining us. This is 20 years we've been doing this. Can we give ourselves a big round of applause?
Thank you so much for the opportunity to talk.
Definitely. KJLH is our 20th anniversary for our KJLH Women's Health Expo. Cover California has come through, bringing their partners in to make sure that we have all the information as to why you need to be covered. Now, if you need to, click that button right down there and listen to this all over again. Otherwise, get to dialing and get some insurance, all right? The deadline is coming up. Thank you guys so much for being here with us. Thank you.
The KJLH 20th Annual Women's Health Expo at KJLHradio.com. Presented virtually by RastAfri and Radio Free KJLH.